Hello, I'm Dr. Peter Miller. I'm the Chief Executive of Leicestershire Partnership NHS Trust. We provide community health and mental health services to over 1 million people across Leicester, Leicestershire and Rutland. On the 10th of July, a report will be published by the Chief Inspector of Hospitals following an inspection that took place at the beginning of March across all of our services. We were visited by over 100 inspectors who visited every ward environment and all of our community teams to make recommendations on how we can improve our services. As I said, that report is due to be published on the 10th of July. Firstly, I wanted to say that within that report it comments very positively on our staff and the care and compassion that they show every day in helping people manage their illnesses. However, with any inspection of this sort, they identify concerns, and they have identified some very specific concerns which I wanted to reassure you about today. Firstly, they were concerned about the safety of some of our environments in which we care for people. Some of those environments are not up to the standard that I want to see. Some of the facilities, some of the maintenance, and the safety of the fabric of those buildings is not as good as it needs to be, and we will be working with our teams to improve those rapidly in the coming months. Secondly, it has been quite difficult to recruit to have the right staffing numbers on all of our wards all of the time. We are ambitious to ensure that we have as many trained nurses on our wards at all times. But sometimes, because of recruiting difficulties, that has been difficult to manage. So we've had to use bank staff and agency staff to make those numbers up. I can assure the public that we always have enough staff on, but sometimes the mix between professionally qualified and healthcare assistants is not where I want to see it. Thirdly, we need to learn from our mistakes. When things happen in health services, which they sometimes do, we need to ensure that we are getting better at ensuring that that learning gets across the whole of our organisation so that our staff can provide the best possible care. Finally, the Chief Inspector of Hospitals noted that sometimes there is a difference between the demand on our services and our capacity to deliver. This means that people have to wait too long for services, and that's not acceptable to me. In some of our services, people have to wait several months to be seen, and this is creating problems for people who have mental health and physical health care crises. So we're committed to work with our commissioners to address this, to increase the capacity in those services to meet the ever-increasing demand of our services. I've been here as Chief Executive of Leicestershire Partnership Trust now for 18 months, and during that time I've seen significant improvements already in our services. We've increased our staffing levels and our skill mix in our nursing staff. We've recruited new occupational therapists to ensure that people have productive days when they're on our wards. We've improved our services for the physical health care of people with mental health problems to ensure they're just as important as their mental health care provision. We've invested in local leaders to make sure the quality of care is as good as it can be on any day. And what we've seen is a real improvement in what patients are telling us. We're getting really positive feedback about the experience of being on our wards, and we want to build on that using the report, the CQC report, and the actions they've identified to ensure that those services continue to be as safe as possible. I want to reassure you that we are, as a board, and I want to reassure you personally as Chief Executive, that we are absolutely committed to providing high quality care to the 1 million people of Leicester, Leicestershire and Rutland, and will be addressing all of the points in the CQC report as soon as possible. Thank you very much.